Most people assume medical help will always be easy to reach. But even in normal times, there are moments when pharmacies close early, supplies run out, or a simple illness appears at the worst possible time. A sudden fever in the middle of the night, a deep cut while cooking, a child with a stomach virus during a storm when roads are closed. These situations are not rare. They happen in ordinary households every year. When they do, preparation makes a quiet but important difference. Having a small reserve of basic medical supplies does not mean expecting disaster. It simply means recognizing that everyday health problems can appear without warning, and access to stores or clinics is not always immediate. Many doctors and emergency professionals recommend keeping a well-organized home medical supply. Not an extreme stockpile, just a thoughtful collection of items that can handle common problems safely until professional care is available if needed. The challenge is that many households keep random supplies instead of a structured system. A few bandages here, an expired medication bottle there, maybe a thermometer somewhere in the house. But when something actually happens, people realize they are missing key items. The goal of a medical stockpile is not to replace doctors. It is to stabilize common problems, and by time, there are 10 basic categories of medical items that cover most everyday situations. The first item is sterile gauze and bandages. Cuts and scrapes are among the most common injuries in any household. Sterile gauze pads allow you to apply pressure to bleeding wounds and protect the area from contamination. Adhesive bandages in different sizes help cover smaller cuts and keep them clean during healing. Without proper wound covering, even small injuries can become infected. The second item is medical tape. Medical tape secures gauze and dressings in place. It allows you to protect wounds that cannot be covered with standard adhesive bandages. It is simple, inexpensive, and often overlooked. The third item is antiseptic solution or wipes. Cleaning a wound properly is often the most important step in preventing infection. Antiseptic solutions or alcohol wipes help remove bacteria and debris before a dressing is applied. This simple step significantly reduces complications from minor injuries. The fourth item is antibiotic ointment. Topical antibiotic creams are commonly used after cleaning a wound. They create a protective barrier and reduce the chance of bacterial growth in small cuts and scrapes. A small tube can treat many minor injuries over time. The fifth item is fever and pain medication. Two of the most common medications found in home medical kits are acetaminophen and ibuprofen. Both are widely used to reduce fever and relieve mild to moderate pain. These medications are often needed during colds, flu, headaches, and minor injuries. For families with children, pediatric versions are also useful to keep on hand. The sixth item is a digital thermometer. When someone becomes sick, knowing whether a fever is present is important. A reliable thermometer provides clear information about body temperature and helps track whether a condition is improving or getting worse. Without a thermometer, people often rely on guesswork. The seventh item is antihistamines. Allergic reactions can happen suddenly from insect bites, food, or environmental triggers. Antihistamines help reduce symptoms like itching, swelling, and skin irritation. They are also commonly used for seasonal allergies and mild skin reactions. The eighth item is oral rehydration supplies. Illnesses that involve vomiting or diarrhea can quickly lead to dehydration. Oral rehydration solutions or electrolyte packets help replace fluids and minerals lost during illness. These are especially useful during stomach viruses or heat-related dehydration. The ninth item is basic medical tools. A good home medical supply often includes tweezers, small scissors, and disposable gloves. Tweezers are useful for removing splinters or debris from wounds. Scissors help cut tape, gauze, or clothing around injuries. Gloves help maintain hygiene while treating wounds. The 10th item is a cold pack or instant ice pack. Cold therapy helps reduce swelling, pain, and inflammation after minor injuries such as sprains, bumps, or bruises. A reusable cold pack in the freezer or an instant ice pack can provide quick relief when needed. Together, these 10 items form the core of a practical home medical reserve. But the most important part of stockpiling medical supplies is not the items themselves. It is the system behind them. Supplies should be stored in one clearly organized location. Medications should be checked periodically for expiration dates. The kit should be easy to access when needed. Preparation only works when it is simple and reliable. Another important principle is moderation. Stockpiling medical supplies does not mean filling a room with equipment. The goal is simply to ensure that common problems, cuts, fever, allergic reactions, dehydration, minor injuries can be handled calmly at home. Most emergencies begin as small problems, having the right supplies allows you to manage those problems quickly and safely while deciding whether professional care is necessary. Prepared households are not necessarily those with the most equipment. They are the ones that understand which tools matter and keep them ready. A small medical stockpile may sit quietly for months or years without being used. But when it is needed, it becomes one of the most valuable resources in the house. Preparation removes uncertainty. And in stressful moments, that clarity can make a big difference. If you found this explanation helpful, consider subscribing to the channel. The goal here is to break down practical health preparedness ideas into clear, simple systems that anyone can understand. And if you want to explore this topic further, there is a useful resource linked in the description that explains home medical preparedness and practical treatment strategies in more detail. It can serve as a helpful reference if you want to build or improve your own household medical kit.